Robert F. Kennedy Jr. is set to overhaul the Health and Human Services Department, slashing 20,000 jobs in total. The HHS secretary made the announcement Thursday following President Trump's executive order to shrink the entire federal workforce.
During the Biden administration, HHS's budget increased by 38%, and its staffing increased by 17%, but all that money has failed to improve the health of Americans.
The department will go from 82,000 to 62,000 employees, resulting in 28 divisions under HHS to become consolidated into 15. Regional offices will get cut in half, with only 5 in the U.S. remaining open. RFK Jr. said, "We are realigning the organization with its core mission and our new priorities in reversing the chronic disease epidemic." So who determines the layoffs? Half of the employees took buyouts from the government, while the rest will lose their jobs. The FDA will cut 3,500 jobs, streamlining operations and centralizing admin functions, but drug, medical device, and food inspectors won't be affected. Trump officials already fired many FDA employees considered to be probationary or new hires. The CDC will reduce 2,400 jobs, shifting focus back to its core mission of epidemic and outbreak response. The NIH will slash 1,200 jobs, centralizing procurement, HR, and communications across its 27 institutes. The Centers for Medicare and Medicaid Services will cut 300 jobs, eliminating duplication. Despite these cuts, RFK Jr. says HHS will save taxpayers nearly $2 billion while doing more.
I want to promise you now that we're going to do more with less. No American is going to be left behind.
The department currently operates with a budget close to $2 trillion, with a large portion dedicated to Medicare and Medicaid programming. A big focus will be on wholesome food, clean water, and removing toxins from the environment. A new division, the Administration for a Healthy America, will merge multiple agencies, tackling key areas like maternal and child health, mental health, HIV/AIDS, and workforce development. The CDC will team up with the administration handling national disasters and public health emergencies. A new enforcement secretary will oversee Medicare appeals, combat fraud and abuse in federal health programs, and manage the Office for Civil Rights. Another division will focus on health policy research, while an additional sector will support older Americans and people with disabilities, integrating Medicare and Medicaid services. The press release clarifies Medicare and Medicaid services won't be impacted by the reorganization. HHS said there are no additional cuts planned right now, but will continue to explore ways to streamline operations. Find more fact-based news right now on the Straight Arrow News mobile app or SAN.com. For Straight Arrow News, I'm Kaylee Carey.